Hi, I'm Steve Adubato. Welcome to a very important and compelling program that looks at navigating the COVID landscape. We have an expert panel. And yes, we're talking about navigating the COVID landscape in urban communities, particularly Newark. Our guests are all connected to the city of Newark, but it has implications beyond that. And also the role of not-for-profit organizations, government, et cetera. We're honored to be joined once again by Dr. Chris Pernell, Chief Strategic and Integration and Health Equity Officer at University Hospital. Michele Adubato, Chief Executive Officer at the Northward Center, an organization our father founded, Michele, in 1970, if I'm not mistaken?
Yes.
Yes, I wasn't born then. That was a joke. It's okay. And Michele is also the founder of the Center for Autism. And let me disclose, she is my younger sister. And Roger León, who is the superintendent of the great Newark Public Schools. Good to have you, all of you with us. Dr. Chris, let me jump right into this. You did a one-on-one interview with us for our State of Affairs program. What do you believe it means when we say, quote, navigating the COVID landscape, particularly in cities like Newark? What does that mean?
Steve, it means preparedness. Look, I have this conversation with our national partners in public health, our state partners, and our partners right here in the beautiful, brilliant city of Newark. We need to help the public understand what preparedness looks like and what's in their toolkit. It's access to longitudinal care. It's where can they get care that is socially and culturally fluent, so that they have appropriate management and identification of disease that would make an infection like COVID more severe or worse. It's access to rapid testing. It's access to know, when do I get tested and what type of test should I get? Can I do a rapid test at home, or should I go to a healthcare provider and get tested? It's access to vaccines and now oral antivirals, so that as soon as a disease is identified or an infection is identified, someone can get into appropriate care. It's helping people understand the steps that they should take in order to ensure that they are healthy themselves and that their entire household is healthy. That's what I mean by navigating. And that oftentimes is not just strictly clinical. That is a mix of both clinical and social services.
And also the superintendent is working with his team to navigate the COVID landscape in the schools. Michele, you and your colleagues in the not-for-profit community, we're a not-for-profit organization as well, the Caucus Educational Corporation. Michele, what does it mean for you and the team? And describe the Northward Center for those who may not know, please.
Well, the Northward Center has a myriad of services that are based in one-to-one contact, in person. It doesn't work on a Zoom. And so we have wonderful preschools that are contracted out by Newark Public Schools. We have youth leadership development programs, Casa Israel Adult Medical Day, family success programs, the Center for Autism that I brought in, and many other services that are based in grassroots. And, you know, what Dr. Chris said was interesting, but, you know, the problem that we're having is it's like people want to think COVID's over.
We're taping going into May 2022. Michele Michele, let me disclose a couple things before you jump back in. Michele had COVID, a very serious case of COVID early on in the pandemic. Dr. Chris has talked very publicly about the personal loss that she has had with her dad in April of 2020 and other family members. Michele, pick up your point.
There's mixed messages out there right now. You know, it's interesting when lockdown was going on, you knew what you had to do. You were locking down, and it was get your vaccination. Then it was get your vaccination. And for a second, you thought this was going to be over. And I'm going to say for a second. And then you realized this isn't over. There's waves of going on. So that's, for us, that's about navigating. How do we navigate those in-person services, which I know Newark Public Schools is doing that. And they're doing it, by the way, a tremendous job. I think they were very, very responsible in saying to our children and our staff, keep your masks on, when others have said, take them off. And really, is this about what we call personal liberties or the health and welfare of your neighbor and yourself? And that's what we're battling right now.
Complicated. Roger, please, navigating the COVID landscape in the Newark Public Schools, 50,000 plus students we're talking about, correct?
Yes, absolutely, 55,000 plus. But the realities of where we are today is quite unique. We've never been here before. The fact that we've experienced this global pandemic and that it has impacted everyone equally has been quite an interesting reality. And when I say equally, I actually mean that, whenever anyone has been in a personal crisis, you turn to someone else. And so this virus has impacted everyone equally in that the people that you go to may be also consumed with the realities that exist because of this virus. I find that it is an incredible opportunity for us to exercise things that are extremely important when you are witnessing ever-changing guidelines. Our strategy in Newark has been to stay the course, to say we are not going to allow the realities of every moment to also shift every single one of our responses, and that the only time that we deviated from anything that we said we were doing was when all of the science suggested that it was the right point and time to do this. Imagine, if you will, people who were getting the vaccine were only of a certain age. The fact that we have 5-year-olds doing it today, contemplating even younger than 5-year-olds, is a reality that we were not witnessing at the moment in time when we were targeting our most elderly. So the over communication becomes also extremely important so that everyone understands what we're doing, why we're doing, and when we are actually doing it.
Well said, Superintendent. Yeah, Michele, I see Michele and Dr. Chris as well, but Michele, I'll come to you in a second. Dr. Pernell, real quick, say whatever you want to say, but the superintendent is talking about our kids. How about kids navigating the COVID landscape? What? Navigate? I just want to play with my friends. I want to go to school. I want to be able to have fun. Like, what is this? How are they doing, Dr. Chris?
COVID has fundamentally I would say impacted social emotional learning, especially for our young people, because we're asking them to learn in ways that they were not necessarily used to. I have beautiful nieces. I have 5 nieces in total from the age of 10 to 16. And I remember one of them who had never stepped foot in a high school building, but had been in high school for almost 2 years. And so on her first time being inside of a high school, she's like, I'm going to have friends outside of my household. And I thought about that and how different that was from when I entered high school, or for my youngest niece, who's in her primary school years, and learning difficult concepts and having special needs and things of that nature, having to navigate that. This has not been easy for our children, whether we're talking about the emotional or even the psychological stress that they've had to encounter because of the isolation, because of doing things that are unusual, and because, they too could get exposed and infected and have to fight a disease that we didn't have a lot of tools for in their age group.
But at the same time, Michele, at the Northward Center, and I know this well only because of the work you're doing, our dad did before, and you mentioned the youth leadership before. As we do this program, we're about to go into the spring and summer season, and I know that kids being outside playing at Roberto Clemente Field in Newark, New Jersey, part of the Northward Center Summer Youth Leadership Program, they're playing baseball. Our son Nick happens to be one of the coaches in that league, and seeing those kids, it's extraordinary. It's the greatest thing in the world, particularly for urban kids. How are they navigating this, Michele? And how much do they need those kinds of programs, please?
I think we have to take the burden off our kids. Whatever I worry about, like my granddaughter said to me, Nona, COVID's done. It's done. Why are you wearing? Because I still wear masks when I go into a supermarket. I feel like I'm the only one wearing a mask. And you know what? I kind of say to her, along with everyone else, it's much better than it was, but sweetie, it's not over. And we still need to take precautions. But I measure myself because I just think our kids have gone through way too much. And it's the adults now that have to be the responsible parties to make sure that their social emotional needs are met, and to weigh risk versus reward, that mitigation process. So our youth leadership development, that wasn't an easy decision. I know for everyone else, and I think it was what Roger said is, do you stay the course? I have to tell you that it is not clear anymore. And I can't tell you why. I can read.
Wait, hold on, Michele. What's not clear?
I'll tell you.
You mean the rules?
Something. The rules make no sense. One day it says I've had 5 people read the same thing and interpret it differently, and that can't. How do you navigate that? So it's about being what Roger said is like, okay, we're going to be reasonable. This is what we're going to do. Like at the North Ward Center, I mandated vaccines. That made a huge difference, but people still got sick. Let me clarify. People still got COVID in January.
But Dr. Chris, they were not as, Michele, I'll come back to you.
They were absolutely
not as sick,
sick.
correct?
Absolutely.
Clinically and non-clinically.
Yes, because in January, let's remember what we were facing. It actually had started late November and December. We were facing the Omicron variant. And this is why I said preparedness, okay? Preparedness means this. You have a toolkit. You have multiple tools. You have multiple mitigation strategies in that toolkit. And you are vigilantly following the science and the data. And that informs you which tool to pull out of your toolkit. So when we got that variant back around that time that Michele was describing, it was a variant that did not have the same properties as the original strain. So it evaded some of the protection of our vaccines. So then we knew that you not only needed to be vaccinated and complete the primary series, but you also had to be boosted. That's what we got to do a better job.
Dr. Chris, I'm going to let Michele pick up her point, because here's the thing. You made that sound clear and logical. Michele is saying, and she's not alone, because Michele, as we do this program, you're making a tough decision about a memorial service we have, a tribute to our father who passed away in October. Go ahead. And we don't know what inside, outside, do we have it? And you have to make that call, Michele. You have to make that call.
Have been in the same situation where my father passed away during COVID. We have yet to respect his and honor his passing.
As we do this program, and you have to decide how and when and if.
And for a second, when I made the decision, and I was very, adamant, you know what? This was 2 months ago. We're going to do this, and this, what happened? January, boom, it went down. And okay, take a breath. Okay, you know what? No one's going to stop us now. We're going to go inside. It's going to be okay. And now it's creeped up and it's another variant. And, these are really what I would just say impossible. There's no right answer, and so you just have to make a decision based on not what everyone else is making a decision on. And that's the problem. There's no clear set guideline.
And so you can't call Roger, Michele, you can't call Roger and say, Roger, what are you doing? Because we're going to do the same thing. Because he has a different circumstance, right? And
that's the beauty of what we have been living, knowing however dark it has been.
Roger, you sure you want to go with beauty?
It is very complicated.
Go ahead.
What the discourse that we just heard between both Michele and Chris is how complicated this is. And what I'm suggesting is that what is going to happen after this is something that needs to be very well studied, because our problem is not only addressing learning loss and
there's a real learning loss. I'm sorry for interrupting, Superintendent. There's a real learning loss for our kids in our schools, correct?
Absolutely.
Go ahead, pick up your point.
So there's learning loss. There's also what I am calling unfinished learning, because students did pick up from March 13th, not until a whole good year and a half later. They didn't finish what they were learning. Then Dr. Pernell's talking about all of the social emotional learning needs that we also have of our students. But that's what we're currently dealing with. The concern that exists is what happens later. I just want to put on the table that there's a lot of unteaching that has to occur. One of our biggest realities is that we have 3- and 4-year-olds in our pre-kindergarten programs all throughout the city of Newark, and there are incredible programs where we have to begin to unteach the importance of sharing. You see, that we've taught students, oh, you hide behind this mask. Oh, you don't share cookies. Oh, you don't hold each other's hands down a hallway. That has created an inherent problem for us as a community. We have to be very empathetic to each other's needs. And we're not able to do that right now because we're overly protecting selves. There's going to come a point in time where this virus is way, way so behind us. And our young children are going to be in a very vulnerable situation in that they have learned behaviors that have to be untaught. And that's the beauty of what I'm referencing at right now, that we should be able to see clearly that there are identified problems that are going to exist way after COVID is gone.
We got about a minute and a half left.
Can I weigh in on 2 quick points, Steve? 2 quick points. I just want to weigh in. So Michele previously said, there's no right answer. What I want people to understand is there is no risk-free scenario. There are scenarios where there are higher risk or lower risk, right?
But there's always risk.
Right, but there's always risk, but we want to minimize the risk. So that's how I want people to think about it. And then the only other second point that I wanted to make is that there are behaviors that we will adapt. Maybe not totally unlearn, but adapt, because living in a crisis does demand a different posture, a different emotional posture, a different physical posture, a different intellectual posture. But I think it also will breed a sense of resilience that otherwise may not have been there. So we have to find both the strengths and the opportunities for improvement.
Michele, final comments. Go ahead.
I hope you're right, Dr. Chris. I hope we learn some good things about this. I'm still trying to figure it out. One thing I do think that we can learn from when people are in constant uncertainty and crisis is be in the moment. When you're having that good moment, that moment that you're sharing, whether it's in a classroom, whether it's in an office and your family, enjoy it. Enjoy it. If I've learned anything from being sick and dealing with this, is enjoy what's in front of you right now.
Well said, Michele. Michele Adubato, Dr. Chris Pernell, Superintendent Roger León, I want to thank all of you. And to be clear, we have a partnership with each one of your organizations in very different ways. And you make a difference in the community in very powerful ways. And I cannot thank you all enough. We talk about navigating. Some people call it surviving, but it's also navigating and hopefully thriving at some point. I'll get off my soapbox, but we can't just simply navigate and survive. We have to thrive. Easier said than done. And hopefully this conversation has been helpful. I want to thank our very distinguished panel. We appreciate it. Thanks so much. I'm Steve Adubato. That's a very smart panel. Stay with us. We'll be right back.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Healthcare Foundation of New Jersey, Veolia, the Robert Wood Johnson Foundation, the Turrell Fund, supporting Reimagine Childcare, PNC, Grow Up Great, the Port Authority of New York and New Jersey, the Russell Berry Foundation, Prudential Financial, and by NJ Best, promotional support provided by Insider NJ, and by NJ.com.
Most people don't think about where their water comes from, but we do. Veolia, more than water, resourcing the world.